I'm in my dental practice since 1985. 40 years ago, we used to use everything analog way, where a lot of time used to be wasted in sending the work to lab. Lab would make some crown in 7 or 8 days time, and then patient would have to come back. In the past 7-8 years, we have moved almost 90% our workflow, we have moved to digital way. And since we use the digital workflow, the time is not wasted as much as it used to be. The errors have reduced to a considerable amount, and in an hour's time we can deliver a crown or an onlay or a veneer to a patient. Recently we have added a Formlabs 3D printer, which has made our workflow completely hassle-free.
The one thing I like about this new technology is that it gives my patients more comfortable, faster and better results, which are more predictable. One of the reasons that we invested in the Formlabs Form 4B printer was the exceptionally clean workflow that they offer. There is no messy resin handling. Everything is very simple, very easy to follow, and it's plug and play. So my associates can do and take care of all the 3D printing, while I focus all my attention on patient care. So this patient, a young gentleman, walked into our practice with the loss of his front 4 teeth. He was devastated at it as his bridge had come off. Now at Aesthetics, what we do is in the first visit, we try to gather the 3D information or the data of the patient. We use 3 things. First, the CBCT scan, the intraoral scan, and the facial scan. Using this, what we do is we create what is called as a virtual patient. Using this information, we sit with our team and we formulate a treatment plan, and we discuss various treatment options amongst ourselves. And we then present that treatment plan to the patient in the next consultation.
After discussing various treatment options with him, we decided that implants were the best solution in his particular case. And what makes this case very interesting is that I was able to utilize the Form 4B in all the different steps in his treatment journey. We first printed some diagnostic models and planned mock-up models in Precision Model Resin at 50 micron thickness. After our plan for the final implant position was decided, we designed his surgical guides and printed it out in surgical guide resin. Now we printed out 2 guides. The first guide was for implant placement and the second was for crown lengthening. Thus, we could ensure that our implant was placed in the exact 3-dimensional position that we want.
And last but not least, the most important part was that the patient wanted to have teeth in the same visit. And we were able to give him immediate temporaries using the Premium Teeth Resin from Formlabs. We printed the temporaries within 25 minutes, and the patient walked out of our practice with immediate provisional teeth, and he could smile once again.
As an orthodontist, I'm looking to provide in-house aligners as a treatment option to my patients. Form 4B has 3 unique features that benefit this workflow. First, the large build platform that accommodates multiple models in one print. Second is the automated resin handling, which allows for a clean workflow. And third is the fast model printing, in which I can print 11 orthodontic models in less than 10 minutes using their fast model resin.
Ever since 2017, it's been a long journey to getting better and better in digital dentistry.